afternoon, Mr. Wahab. My name is Courtney. I'll be your nurse today. I've heard that you've been having some lower back pain that's kind of radiating to your right leg. So we will address that today. But first, I want to do a full and complete head-to-toe assessment on you. It should take about 20 to 30 minutes. And what I'm going to do is I'm just going to work from your head all the way down to your toes. We're going to do some neurovascular tests as well as some musculoskeletal tests. And during any time during the assessment, if you feel any type of discomfort or pain, just let me know and we will address that. Sounds good? Okay, I've already washed my hands and I've also cleaned my stethoscope, so we will get started. First, I'm going to start in the head and I'm just going to inspect. I'm really looking for symmetry, making sure that the right and the left side are equal. I'm also looking for any swelling, any redness, any bruising. Everything looks good. And I'm going to start and I'm going to palpate the scalp again, just feeling for any swelling, any type of abrasions, anything like that. Okay, I'm going to look in the face again. And now I'm going to palpate your sinuses. Let me know if you feel any pain. Anything at all?
No.
Excellent. That's good. Okay. Now I'm going to take my pen light and I'm just going to assess for pupillary response. And then if I had a speculum, I would inspect the nose for any erythema, any drainage. And then I'm going to look in the ears as well, looking at the tympanic membrane for any drainage, no drainage noted, or erythema. I'm going to do the same thing on the other side. Okay, excellent. Now I am going to have you follow my finger. This is just testing for any cranial nerves. Excellent. Okay. Now can you say ah for me? Okay, looking for any redness. Good. Now if I had a tuning fork, what I would do is I would do the Weber's test and I would just hit the tuning fork and I would put it on the forehead, and what I'm testing for is bone conduction, and I want to make sure that my patient can hear the vibration equally on both sides, so with his right ear and with his left ear. And then I would also do the Rene test, and what I would do is I would place the tuning fork on the mastoid bone posterior of the ear, and that's testing for air conduction and bone conduction, and I want to make sure that my patient will be able to hear the length of the vibration equally on both sides. Okay. Then after that, I am now going to inspect, or I'm going to palpate the lymph nodes. Do subclavian. Do you have any pain or tenderness at all?
No.
Okay, good. Okay, and now I'm going to inspect the neck. So if you could just lift up the neck. Again, I'm looking at the trachea, making sure I don't note any tracheal deviation. Can you swallow for me? Okay. And now I'm going to go in the back here. Okay, can you swallow for me? One more time. Okay, excellent. Okay. So now that I've done the head assessment, I'm going to go ahead and do the posterior chest. So if you could just turn your back or turn that way. Okay, I want to make sure that you can see this. Okay, stand straight up for me. Yep. Okay, so to begin with, I am just going to inspect the back. I am looking for any type of bruising, any swelling. I really want to note the symmetry with the breath, so could you take a deep breath for me? And I'm evaluating chest expansion at this time. And everything is moving symmetrical, good. Now I'm going to palpate the spine. Let me know if you have any pain or tenderness.
No.
Okay, good. Now every time you feel my hand on your back, could you please say 99?
99, 99. 99, 99, 99, 99.
That was Farmer test. Okay, now I'm going to percuss the back. I'm also going to check for CVA tenderness, so please let me know if you feel any pain. Anything? Good. Okay, so now I'm going to auscultate the back, or your, I'm going to auscultate your lung sounds. Every time you feel my stethoscope on your back, if you could please take a deep breath. Okay, excellent. Now we're going to do the anterior chest, so if you can turn towards me. Okay, so I'm just going to inspect the chest first. Again, looking for symmetry, making sure that I don't note any swelling, any bruising at all. And I'm also going to palpate, checking for thrills. And I'm going to percuss. Okay, next I'm going to do firmness, so if you can say 99.
99, 99, 99, 99, 99, 99.
Excellent. Okay, now I'm going to auscultate your anterior lung sounds. So again, every time you feel the stethoscope on your chest, if you could just take a deep breath, okay? Okay, now you can relax, and now I'm going to auscultate the heart sounds. Aortic, pulmonary, nerves, tricuspid, and then mitral. And I'm going to do the same thing using the bell side of the stethoscope. Okay, excellent. Now I'm going to do a cardiac assessment with the patient lying down, so if you could lie down for me. Okay. Can you scoot a little bit closer to me? Okay. And then put your hands down, your arms down. Now, what I'm looking for is I'm going to look at the neck, and I'm looking for any type of jugular distension, making sure that everything looks symmetrical once again. Okay. Next, I'm going to auscultate the carotid arteries. So, could you hold your breath for me? Okay, you can breathe. Hold your breath for me. Good. Okay. Just checking for any bruits in the carotid arteries. Now I'm going to inspect the chest once again, but this time with the patient lying down. I'm also going to palpate, checking for any thrills, and I'm going to percuss. Okay, every time you feel my hand on your chest, can you say 99?
99, 99, 99, 99, 99, 99.
Excellent. Okay, now I'm going to auscultate the heart while my patient is lying down. do the same thing using the bell side. Okay, excellent. Okay. Now I'm going to do an abdominal assessment. I'm just going to put my arms right here. And I'm just going to start off by first with inspection. So looking for any type of stomach distension. Again, making sure that everything looks normal and that there's no redness, any swelling or anything like that. Next, I'm going to auscultate the 4 bowel quadrants. Now I'm going to check the aortic artery, renal, the iliac, then I also would auscultate the femoral artery and palpate the femoral artery and the inguinal nodes. Okay, so after that, next I am going to percuss, and so I'm just going to tap on your belly. And then I also want to percuss the liver border to check for any type of hepatomegaly. So checking to make sure I feel dullness, and then down to the liver. Okay. And then I'm going to palpate. So I'm going to do light palpation. And then I'm going to do deep palpation. And then I'm also going to palpate the spleen. And then I'm going to palpate the liver. Could you take a deep breath for me and exhale? And I was just checking the liver border there. Okay. So next, I'm going to have my patient sit up. If you can sit on the edge of the bed for me. So next I'm going to do lower extremities. And I'm just going to inspect, again, looking for any swelling, any type of bruises. I know that you do have a scar on this side from your patella surgery. Okay. I'm going to palpate for any edema. Do you have any pain at all? Any calf tenderness? Excellent. Okay, so I'm going to palpate the dorsal pedis pulse. And I'm also going to check for cap refill. Okay. And if I were wearing gloves at this time, I would change my gloves, and I would also wash my hands because I'm moving from the feet up to the upper extremities. So now I want to check your radial pulses. Okay, and then I look at your cap refill. Good. Okay. Okay. So now I'm going to do a musculoskeletal exam, and I'm just checking for muscle strength. I'm doing some range of motion, making sure everything looks good in that area. After that, we also will do a neurovascular exam, checking the different cranial nerves and as checking for sensation as well. Okay. So can you shrug your shoulders for me, and don't let me push your shoulders down? Okay, good. Can you kind of move your neck like this? Forward, back. Nice job. Can you spread your arms out? Okay, don't let me push your arms down. Okay, can you push against my arms? Excellent. Can you push your arms like this? Okay, again, don't let me push. Good. And then push against. Excellent. Can you squeeze my hands? Good job. Okay. Now I'm going to go to the lower extremities. Okay. Can you lift up your knee for me? Okay. Can you push against my hand? Excellent. Can you do the same thing? Push against my hand. Excellent. Okay. And then push against my hands. Okay. Don't let me push. Excellent. And then for your feet, can you act like you're stepping on the gas? Good. And then don't let me push your arms down. Good job. Okay. Excellent. So now we are going to do some cranial nerve test. So can you follow my finger? Excellent. If I had a snail chart, I would also have my patient do that exam as well. We are going to do some sensation tests now. So this is sharp and this is dull. And what I want you to do is I'm going to have you close your eyes and I'm going to poke you with either the sharp side or the dull side. And I want you to tell me, point to where I poked you and tell me if it was sharp or dull, okay?
Sharp. Dull. Dull. Sharp. 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 Dull. Dull.
Excellent, okay. And then if I had a reflex hammer, then I would check my patient's reflexes and I would hit the hammer on the radial and see if I see any type of contractions in the hand, brachial as well, contractions in the arm, and then you can bend your arm like this, bend your, okay. And then the tricep. And I would do the same thing on the other arm, and then I would go down and I would hit the knee, looking for contractions of the leg, and then I would hit the Achilles as well and look for some type of contraction in the foot. Okay. So now I'm going to have my patient stand up, please. And now could you back up a little bit? Turn this way. And now I'm going to observe my patient's gait. So what I want you to do is kind of walk heel to toe in a straight line. There we go. Keep going. Keep going. Okay. Now you can just walk regular going back the other way. Just walk how you usually do. Nice job. Okay, now turn towards me. Now we're going to do the Brombaug's test, and that's just testing for cerebral function. So feet together, arms out, palms up. Close your eyes, looking for any drifting. Excellent job. Okay, so now you can stop. So now I'm going to do, can you turn the other way? I'm going to do a spinal exam, and I'm just going to be looking at the spine. Can you touch your toes for me? Okay, excellent. And stand up. Now can you do a side to go to your, put your hands on your hip and kind of go to your left side? Good, and go to your right side. Okay, now can you twist at the hips? Twist the other way. Excellent job, okay. Now can you sit back down? Okay. Okay, now continuing on with the neurovascular exam. Can you clench your teeth? Can you puff out your cheeks? Can you wrinkle your forehead? Excellent. Okay. So now I'm just going to double check to make sure that I got everything. Okay. Okay. Can you look at me? Now I want you to touch your nose. Repeated movements. Okay. Now can you touch your nose with the same finger, touch your nose, and then touch my finger. Touch your nose, touch my finger. Touch your nose, touch my finger. Touch your nose, touch my finger. Excellent. Now can you do rapid movements with your hands? Great job. Same thing on the other hand. Great job. Now with you, can you put your legs down? Okay. Now can you take your heel and move it to your shin? Do the same thing with the other hand. Go down. Excellent job. Okay. So now I'm going to do my focus exam, really honing in on the back pain that my patient has that radiates to his right leg. Now, whenever you have lower back pain that kind of radiates into the leg area, this could be a sign of some type of pressure on the sacroiliac nerve, which is located in the lower back. And so there's a couple of different tests that we can do. We can do the straight leg test. So I'm just going to have my patient raise his right leg. And between 30 degrees and 60 degrees, if he has any pain, then that would be a positive sign for that sacroiliac. Just going to raise leg that way. Okay. And then I'm also going to do the Faber test. And what I'm going to do is I'm going to raise the right leg. I'll have my patient flex his knee. We're going to do abduction, internal rotation, and if there's any pain, and then I'm going to press on the knee and press on the iliac spine, and if you experience any pain here, then that would also be a positive sign.